Welcome to the Ottawa Hospital. On behalf of our management team and our clinicians here, I'd like to welcome the Canadian Patient Safety Institute to launch their new resource called Shift to Safety. It's my pleasure to be your Master of Ceremonies today and to coordinate the presentations that will be coming up. My name is Dr. Alan Forrester. I'm the Chief Quality and Performance Officer of the Ottawa Hospital. I'm also a general internist, so I see patients in the hospital and all throughout the hospital. And so for many reasons, patient safety has been very near and dear to my heart throughout my career. I've been happy to work with the CPSI at various points in my career as well, both as a clinician and as a researcher. So for that reason, I'm very excited to host the announcement because patient safety is a very major priority for the Ottawa Hospital. As one of the largest learning and research hospitals in Canada, we want to be at the forefront of providing our patients with safe, highly reliable, and high-quality care. And we're always striving to make improvements. So with that in mind, I'd like to step back and introduce Chris Powers, the Chief Executive Officer of the Canadian Patient Safety Institute. Since Chris was appointed CEO of the CPSI, in March 2015, she has traveled the country to advance patient safety and the quality improvement agenda. Through a series of summits and roundtables, she has brought together the movers and shakers in Canadian healthcare to develop an integrated patient safety action plan that is making great strides to improve the safety and quality of care for all Canadians. Today, she is here to unveil a new resource that will, without a doubt, shift the patient safety and quality improvement landscape in Canada. Chris, over to you.
Thanks very much, Alan, and welcome and thank you everyone for joining us. Today we are so excited to launch Shift to Safety, a new initiative aimed at reducing preventable adverse events that occur in Canadian healthcare facilities. Thankfully, most times care is delivered and received in a safe manner with very good outcomes. But sometimes we don't get it exactly right. Did you know that despite the efforts of healthcare providers, every year about 30,000 Canadians die from preventable adverse events in hospitals and long-term care facilities? That more than 84,000 Canadian seniors are hospitalized due to a fall? And that over 200,000 patients acquire an infection that they didn't have before they came into hospital. These numbers are staggering, and we know that we can do better. Over the past year, much work has been done in strengthening and strategizing and planning to ensure that CPSI remains relevant to its stakeholders and that we can meet their evolving needs. We could have just continued to do what we always did, but the reality is that the world is changing around us. New evidence is emerging, and we must be prepared to change and adopt a new way of thinking. When we looked at the challenges and opportunities that lie ahead in the patient safety world, or some would call it the burning platform that's driving our efforts through these changing times, we looked to provide answers to the most pressing patient safety questions everybody was asking to help reduce the incidence of patient harm. Those questions are, how do I prevent harm? How can I respond when harm happens? And how can I learn from harm that's already happened? To reduce patient harm, I'm delighted to announce that the Canadian Patient Safety Institute is launching Shift to Safety, a national program that's comprised of essential information and advice designed to help the Canadian public navigate the healthcare system and advocate for their own safety, as well as tools and resources for healthcare providers and leaders to keep those they have the privilege to serve and themselves safe. Shift to Safety is the product of in-depth interviews and joint consultations that were conducted with stakeholders in 2015, including patients and family members, healthcare providers, and leaders, to better understand the needs and challenges of Canada's healthcare system and how patient safety can be enhanced. This is what we learned. Patients told us, "I'm more than a body. I'm a person. Listen to me. I have something to say." Patients need to be listened to, understood, respected, and included in the decisions that affect their personal safety and care. They want to know, what can I do to keep myself safe? Friends and families said to us, I'm the communication bridge between my family and the provider. Acknowledge me for the value I bring. Friends and families need to be recognized as a contributor of information and observations and given an opportunity to actively ensure the safety of their loved ones. Healthcare providers reinforced for us, we need to learn together and work as a team. Recognize us for doing the right thing. Practitioners need to be recognized for working collaboratively with their colleagues, patients, and other stakeholders for ensuring safer care. They're a valuable member of a caregiving team. And leaders said to us, how do I promote and prioritize new behaviors that lead to a positive patient safety culture? Leaders need to be able to influence the behaviors of their organization stakeholders to develop a positive patient safety culture. They asked us, how can I make patient safety a priority in my organizations amongst all the competing priorities? With this feedback, one thing became crystal clear to us, that transformational change does not happen without cultural change. Shift to Safety is a major shift to empower and provide the tools and information you need to keep patients safe, whether you're a member of the public, a practitioner, or a leader. Shift to Safety will help patients and their families shift to advocate for their healthcare safety, healthcare providers shift to prioritize safety when caring for patients, and leaders in healthcare organizations shift to create a positive patient safety culture. ShiftToSafety.com includes extensive resources designed to reduce avoidable harm. For example, patients and healthcare providers are directed to a checklist of 5 questions that patients should raise with their physicians to make sure they don't unwittingly put themselves in harm's way. Visitors can access a wide range of resources that will contribute to ongoing patient safety education and awareness as the site continues to grow. We invite you to visit www.shifttosafety.com to learn more. What we have online now is just a fraction of what we'll be releasing in the months and years to come. And it's more than just an online program. There will be lots of resources, abilities for people to interact with folks, collaboratives. There will be so much here to help the Canadian population. Improving patient care safety and quality in Canada requires everyone's involvement. Ensuring the whole system works together seamlessly while encouraging a patient safety approach in an organization is challenging. Together, we can make safety a priority while navigating the healthcare system. Let's make the shift to safety today. Thank you.
Thank you so much, Chris. The Ottawa Hospital is really about what Shift to Safety stands for engaging patients and families as partners in their care, and always striving to improve and do better. When we can learn from our experiences, we can address problems so we don't repeat them. And we have a number of activities that help us learn from the input of our patients, including a post-discharge phone call program where we get patients telling us exactly how things went when they got home. Our next speaker is Brian Wheelock. He's the incoming board chair of the Canadian Patient Safety Institute. Dr. Wheelock is a neurosurgeon from Horizon Health Network in St. John, New Brunswick. He is a member of several medical associations, and since 1983 he has been a fellow of the Royal College of Physicians and Surgeons of Canada. He has a history in clinical and administrative medicine and has been intimately involved in activities of the Canadian Patient Safety Institute. Thank you.
Thank you, Alan, and I'd like, on behalf of the Board of Directors, to thank you very much for hosting this event. It's wonderful that you've done that today, and we're very pleased to be here. Good morning, everyone. Bonjour tout le monde. On behalf of the Canadian Patient Safety Institute Board of Directors, I'm excited to endorse the launch of Shift to Safety, an extensive new resource designed to reduce avoidable harm. The key benefit of shifttosafety.com is that it provides patients, providers, and leaders immediate access to resources that facilitate teamwork, communication, and a culture of safety. The decisions that healthcare leaders make have profound and long-lasting consequences. They need support and guidance for initiating actions that result in an environment and culture of safer care. They need a new set of protocols and processes that will promote an open and collaborative culture within their organizations. And above all, they need an integrated solution that helps align all the stakeholders in the entire system. Les professionnels des soins de santé de première ligne constituent le groupe le plus concerné par la nécessité quotidienne de prodiguer des soins de santé sécuritaires et de haute qualité aux personnes malades. Ils ont besoin d'occasions d'apprentissage, de nouvelles compétences qui amélioreront leur résolution de problèmes, qui faciliteront la collaboration et qui les feront grandir en tant qu'équipe, tout en encourageant la création d'un environnement propice aux soins de santé sécuritaire. In addition to these practical abilities, interactions with patients and other members of the healthcare team can be improved through soft skills training and empowerment as key drivers of change towards a safer healthcare system. Shift to Safety will deploy system-level improvement collaboratives designed to integrate the efforts of patients and families, care providers, and leaders working together as a team for patient safety and quality improvement. Shift to Safety will therefore produce content that goes beyond clinical frontline interventions, putting greater emphasis on the context of care improvement with a special focus on teamwork, culture, and communication. Passons à la sécurité, met de l'avant une expérience positive de soins de santé sécurité pour les patients, les fournisseurs de soins de santé et les dirigeants d'organisations des soins de santé. C'est utile et ressources aideront chacun à comprendre comment faire de la sécurité une priorité au sein du système des soins de santé. Let's make the shift to safety today. Merci.
One very innovative feature of the Shift to Safety initiative has been the involvement of patients in the development of it. And I'm very pleased to welcome Barb Farlow, who has been the main driver of that. She is an advocate with Patients for Patient Safety Canada. She represents the hope, anguish, fear, and anxiety of every patient, client, and resident accessing health care in this country. This patient-led program of the Canadian Patient Safety Institute recently celebrated 10 years representing the patient perspective and is still going strong. Please welcome Barb Farlow.
Thank you. It's a pleasure to be here at the Ottawa General. I did want to add a personal note that my sister-in-law is receiving ongoing cancer treatment here, and her care has been nothing short of excellent. So thank you for that. On behalf of Patients for Patient Safety Canada, it is my pleasure to support the launch of Shift to Safety. Patients for Patient Safety Canada is the voice of patients in the healthcare system. We represent the patient perspective to advance patient improvements at all levels in the system. The Patients for Patient Safety Canada network is made up of more than 70 patients and family members, most of whom have experienced harmful events. We have a deep desire to prevent harm and improve the quality and safety of healthcare. We volunteer our time to act as trusted partners to champion patient safety and patient-centered care. I joined Patients for Patient Safety Canada to make a difference in changing the culture of patient safety. Often, care provided at the bedside is void of the patient experience. While we have made great strides advancing the patient voice and patient involvement, there is still much more to be done. Pressures in the healthcare system and demands on staff have led to increasingly distant relationships between the provider and us. Passed from one practitioner to the next, we can feel like a defective piece of equipment moving along an assembly line. While we don't claim to be experts in medicine, we are experts about how we feel and are in the best position to describe our own context. It's frustrating to be treated like a machine, void of this valuable perspective. Armed with sufficient knowledge of their conditions and given the opportunity to voice their thoughts and opinions, even sick patients can be a valuable contributor to ensuring a safer healthcare system. Our families and friends are often supporters along the journey through the healthcare system. They see all the ups and downs and want to do whatever is in their power to ensure that we, their loved ones, receive the quality and safety of care that we deserve. They too are keepers of important information, have valuable insights for assessing and preventing risks, and can provide essential support to both the patient and provider. In the current system, these supporters are often left uninformed and powerless to help enable a positive outcome for the patient. This environment is especially frustrating following a safety incident in which their contributions of knowledge or observations could have made a difference in their loved one's care. Given the opportunity to be regular members of the healthcare team, family and friends can be key enhancers of safety in the system. Shift to Safety will help patients to advocate for their healthcare safety. I'm proud to say that I was a collaborative member in its development. Shift to Safety empowers patients with information and tools to help us ask good questions, connect with the right people, and learn as much as we can to keep ourselves or family members safe while receiving health care. When a family member or I need medical attention, we expect safe, thorough care. We also expect to be heard. No one knows our bodies or our situation better than we do. Shift to Safety is a valuable online resource to help the Canadian public navigate the healthcare system and advocate for their safety. We want to be and we need to be active participants in our healthcare. And these tools and resources now available through Shift to Safety will go a long way to help us realize just that. Thank you.
Thank you, Barb. I hope you agree with me that that story illustrates how important it is to ensure we're engaging families and patients in our planning. Just to wrap up, I'd like to mention a few things of what we're doing at the Ottawa Hospital, which help to illustrate and highlight and perhaps underline the importance of this shift to safety that's going on, and how we at the Ottawa Hospital will work with CPSI to ensure that we succeed through this effort. For about 2 years, our quality department has been hosting a quality rounds every 2 weeks at our institution. And that quality rounds really consists of frontline staff who come and present their efforts to improve safety in our hospital. Every 2 weeks, a different team of clinicians, frontline staff, present their efforts to try and improve safety. And most of the time, these efforts are informed through voluntary reports of incidents that occur in our institution. One recent example, and I'd like to just highlight why this is important through an example, was around a case where there were 2 patients with the same name on a ward. And one of our clinicians felt this was a very worrisome situation and started exploring how commonly that occurred. And it actually occurs in our hospital. Probably between 2 and 10 patients in our institution today will have the same last name. And occasionally those people will be on the same ward together. So you can imagine there may be some risks. The patient may get the wrong drug treatment, they may get taken for the wrong test, or people may even come and give instructions to the patient and think they're giving it to the other patient. So this doctor, who was concerned about this, did work on it, got a small grant from our Department of Medicine to put together a plan to reduce it, worked with our safety coordinator, and came up with a strategy to prevent this problem, which included human factors engineering approaches that would address the problem. So I'd just like to show that as an example where frontline workers feel empowered to look at real problems that threaten the safety of patients. They work with colleagues who have expertise in safety, and they then implement solutions by working with leaders to get small investments to make improvements. I think that's a very powerful story for the Ottawa Hospital, but imagine if those stories are being shared across Canada, and so that all hospitals across Canada are getting access to those kinds of stories. And I see the shift to safety as a key piece of that, in that we'll be able to start sharing this information real practical stories from the front lines about improving safety, which should really benefit all of us who work in the healthcare system and ultimately patients who we're here to serve. So with that, I'd like to conclude. I'd like to thank everyone for coming. I'd like to thank the CPSI for thinking of us to put this great event on, to launch their great initiative. And I also would like to just finalize by encouraging you to visit their website, which is www.shifttosafety.com. Thank you so much.